Human movements are described in terms of the plane in which they pass through. There are three planes of motion: the frontal plane, the sagittal plane, the transverse or horizontal plane. The frontal plane passes through the body from left to right, dividing the body into anterior and posterior parts. Frontal plane movements are lateral, side-to-side movements. For example, abduction and adduction. Lateral flexion of the spine. Foot inversion and eversion. Wrist radial and ulnar deviation. And scapular elevation and depression. The sagittal plane passes through the body from front to back, dividing the body into left and right parts. Sagittal plane movements are forward and backward movements. For example, flexion, extension, shoulder flexion and extension, elbow flexion and extension, spinal flexion and extension, ankle dorsiflexion and plantar flexion. The transverse, or horizontal plane, passes through the body in a line parallel to the floor, dividing the body into top and bottom parts. Transverse plane movements are twisting or rotational movements. For example, horizontal adduction and abduction, or horizontal flexion and extension. Spinal rotation. Internal and external rotation. Pronation and supination. Here are some demonstrations of strength exercises in the various movement planes.